Good morning, everyone. I hope you guys are having a good week so far. And as always, thank you so much for tuning in. It has been a little over a week since my last video, and it has certainly been a week, if not maybe closer to 10 days. Crazy, tumultuous, insightful, frustrating, scary, inspiring. I think we have all probably had every emotion possible over these last 10 days. And I think one thing that many people continue to feel is confused. Is coronavirus gone? Was it ever real? Now articles are saying maybe it's not that contagious. Why are we opening back up if some people are saying all the numbers are increasing? And I don't blame you for being confused, and I'm going to try and alleviate some of that confusion in today's video. And while I do not want to detract in any way from this fight against racism that has captured so many of our minds and our hearts right now, I do want to try and educate you best on what's happening with this virus. So first, let's talk about the protests and the pandemic. Again, I think many people are confused because some people are fervently fighting this pandemic, and they are also saying that it's okay to protest, but it's not okay to get your hair done or to go to the gym or to go to the movies. And we were all, at least I was, stunned looking at the beaches and the lakes over Memorial Day weekend, and we have literally talked so much about social distancing that some of us can't even stand that term anymore, and suddenly it seemed like the term disappeared. And once again, people were left confused as to what they can and can't do. So here are some of my thoughts on this particular issue, and then we'll get going on what's happening with the virus. I think we can all acknowledge that racism has unfortunately been present and somewhat embedded in our society since the inception of this country. And the filming and death of George Floyd is essentially the straw that broke the camel's back. It was a fire that has been brewing for months, if not centuries, and with recent events, it just exploded. And people decided, pandemic or not, it was time to fight back. And the way I see this on a much grander scale, of course, is how we teach our children, both in the way of positive and negative reinforcement. When our kids do something good, we commend them. When they do something bad, we reprimand them. And I think that as parents, we all know that in order for this to be most effective, our action has to happen immediately after our child's action. It doesn't really do any good to praise or punish them for something they did weeks ago. And so the immediacy of our action as parents will determine whether our kids choose to repeat their behavior again, whether it was good or bad. And so while these protests are undeniably going to increase our coronavirus numbers, one report actually said up to 3,000 per day nationwide, I personally think they are and were necessary to fight another pandemic that has been present far longer than coronavirus. And that in itself is a pandemic that there is no vaccine for, and there is no medication for. And it's one that's going to continue to burden our lives and our kids' lives if we don't invoke change right now. And this is a cause that, quite honestly, at the end of the day, is more important than having a temporary hold on the fun things that we like to do, like getting our nails done or our hair done, going to work out in a public gym, or going to watch a movie in a theater. And before I move on to the virus, which I think is a little bit more of what I'm well suited to speak about, I want to be clear that in my mind, this fight is everyone against racism. It is not white versus black. It's not blue versus black. It's not red versus blue. And as the headlines will soon start to say, it's not Black Lives Matter versus coronavirus. It's simply everyone against racism. So, and if you are protesting, please wear a mask, and if possible, consider getting yourself tested before you are around those who are most vulnerable to this virus. Okay, so what is going on with this virus? It's very different everywhere, and so I think it's important to be aware of the numbers around your city or your county or your state. But again, just like our weight, don't watch the numbers every single day and too closely, because it will just invoke more anxiety. But here's what's been going on in my county. On May 9th, so 1 month ago, we had 1,228 cases and 15 deaths. 1 month later, and this was actually June 8th numbers, we had 2,794 cases and 47 deaths, with 1,824 recoveries being reported. That's more than 2 times as many cases and 3 times as many deaths. And again, I want to be clear, these numbers are not a reflection of the protests. These numbers are a reflection of opening up life and Memorial Day activities. And yes, half of the 47 deaths that I mentioned are in nursing homes, but I feel like people are starting to use that as an excuse. And to me, it doesn't make it any less of a death. It just highlights the fact that we already know that elderly folk are very susceptible to aggressive disease with COVID-19. And we're now at the point where 1 in 7 Americans actually know someone who's died from this virus. And I'm sure all of you saw the statistics. Over 100,000 people have died in America from this virus. And something that I think people are not paying attention to, but really caught my eye, is that 282 cases here in Kern County are in kids ages 0 to 17. And I'm now starting to have personal experience with this. Again, thankfully, these kids are not very sick, but they are contributing to the cases ever so slightly. Many counties are starting to see days where they've had their highest daily case load ever, including on a nationwide level. That happened to us here in Kern County both this past weekend, where we had 116 cases per day, and the weekend before, where we had 105 per day. And there's no doubt that small daily increases are going to happen. That's simply inevitable because businesses have opened back up, life has opened back up, people are starting to get back together. And of course, as a healthcare provider, I wish I could prevent any and all spread of this virus, but that's not a realistic expectation. While this virus is going to be present, and honestly, it's going to be present for the foreseeable future, we have to find this balance of living our life but not creating a resurgence of this virus that could cause devastating effects like what we saw in other cities, particularly New York City. In fact, what I read over the weekend is that Arizona's largest health system, Banner Healthcare, reached its capacity on ECMO machines over the weekend. These are machines that are for the sickest of the sickest, essentially where a traditional ventilator is no longer enough for them. And they ran out of those machines this weekend. So it makes me feel like this saga is starting all over again on the West Coast when we were fortunate enough to have avoided it the first time around. And most importantly, we don't want to see more deaths. We've all been surrounded by enough death in 2020. But also, I think it's important when we gauge our actions to look on the horizon. Kids' school is coming up in the fall, and that's actually just 2 months away for those of us in Kern County, where we tend to start in mid-August. Team sports, attending sports events, concerts, weddings. I just don't know if these type of things would necessarily come to fruition in 2 months or less if we're tripling our local death rate every single month. So I don't share these numbers to instill fear in you. I just want people to realize that the virus is still here and it's going to be a part of our day-to-day activity. And many are looking for answers of what's okay to do and what's not okay to do. And at this point in time, it really comes down to personal risk versus benefit and what you are willing to do to protect others. So let's first talk a little bit about personal risk versus benefit. And again, these risks are different in different cities because each city has its own different dynamic of what's happening with the virus. But with each outing that you're planning, whether it's a trip to the grocery store or a trip around the world, there's going to be exposure risk. We know that. And you essentially want to ask yourself, is the risk of that particular activity and the increased exposure worth the benefit? And without even really thinking about it, this is an exercise that we do on a regular basis when we assess the risk of driving in our cars with and without our seatbelt, traveling to different locations. You know, some of us like to stay local, some of us like to camp, some of us like to get on a plane and go as far away as possible. And when it comes to small things like the risk of going to the grocery store to buy food, well, the risk is worth it because the grocery stores are trying to minimize our risk. And of course, we need to eat to live. For some, when it comes to activities like getting together with family or friends, eating in restaurants, even getting their hair done, the risk is still worth the benefit. And I am not here in any way, shape, or form to try and change the world's priorities. Each of us finds happiness and self-care and content through different venues, and it's not my job or any of our jobs to judge what other people are doing. But the difference here is that some of the risks that we take right now are going to affect others, including some people we don't even know. And so I compare it to this. If you want to go bungee jumping or you want to jump out of a plane, the risk is largely on you, right? Yes, your friends and your family might be very sad if you died in this process, but you're not necessarily putting anybody else's health or well-being or life in danger with those actions. But when we go out in a community where our numbers are rising without masks, because our own beliefs of how healthy we are or how weak this virus is, we're essentially saying that our thoughts are more important than the well-being of others. And to me, that's just not right. And so this is where our willingness to protect others comes in. And what's important is that we try to adhere to the social distancing guidelines in public venues, especially in the closed buildings, and we wear our masks. There will be a time when we can get together in groups of 50 and 100 and 500 like I had at my own wedding. But right now, it's just not the time. We want to try to keep our gatherings on the small side. And so for those of you who still want to stay at home, that's okay. Please don't judge those that are not ready to go out into the real world and go to parties and participate in life like we did in February and March. And for those of you who want to go out, that's okay. Just do it safely and think about others. The goal is for us to get back to enjoying our lives, to make the last half of 2020 better than the first half, not to judge one another in our actions, but to keep each other safe. And I think it's more apparent now, quite honestly more than ever, that you can't hold Americans down, not for any extended period of time. But you can ask them to do good for others, and they will rise to the occasion. And so lastly, I do want to add, I know everybody is very confused about a report that came out on CNBC yesterday, where the WHO is stating that their preliminary evidence shows that asymptomatic spread of coronavirus is very rare. And well, part of that we already know. If you have an active cough, of course you're more likely to spread this virus than if you don't have a cough. That's a bit of common sense. But to see whether asymptomatic people have a low enough viral load in their respiratory droplets such that they are spreading very little amount of this virus to the community, I think that remains to be seen. So I would sit tight on that. I think we need to really look at the evidence. We need to have it peer reviewed before we jump on that bandwagon. So in conclusion, this is a little shorter than normal for me, but here are my recommendations as times are constantly changing and ever so confusing. Don't live in a bubble and don't live in fear. Don't assume that what you see your friends doing on social media is what's real life for everyone. And don't judge others. It will just mentally exhaust you. But do think about what makes you genuinely happy and what makes your family genuinely happy and what can wait until a little bit later down the road. Do preserve your mental and your physical health. Do practice social distancing and wear your masks and just take one step at a time. It's been quite a year, and I think that quote that has been circulating on social media this week by Leslie Dwight probably says it absolutely the best. And it says, not exactly, but maybe 2020 is the year that is going to be so uncomfortable, so painful, so scary, so raw, that it finally forces us to grow. A year that we can finally band together instead of pushing one another apart. So I hope this helps. I know it is an eternally confusing time in our lives right now, but it will pass, and I wish you guys a great rest of the week. I'll talk to you later.